vaginal dryness, painful intimacy, which is also sometimes called dyspareunia, bleeding after intercourse, constant urinary tract infections, urinary incontinence or leakage when you cough or sneeze or laugh. All of these are symptoms of something called the genitourinary syndrome of menopause. While those symptoms can have a huge negative impact on your life, GSM can develop into even more awful symptoms. Later on in this video, I'll let you in on what those awful symptoms might be. Trust me, they're not good. What is good is that there are some treatments that make a huge difference in GSM. Let's talk about one of those. It's called Imvexxy. I'm Steve Goldring, the hormone pharmacist from simplehormones.com. I've earned multiple certifications about hormone replacement therapy, or HRT. Hundreds of hormone doctors all over the US, Canada, and the UK trust me to teach their patients about hormones that aren't too high and they're not too low, but they're just right. I help women in menopause answer one simple question. Is HRT right for my menopause symptoms or not? I've created a clear, concise digital course that helps you make your HRT decision in about 2 hours, more or less. For information about the course, visit my website at simplehormones.com/decision. GSM, or the genitourinary syndrome of menopause, is a problem for somewhere between 50 and 80% of women in menopause, depending on which study you read. Vaginal dryness, painful sex, urinary symptoms, they aren't likely to get better or to go away as time goes on. Instead, they're very likely to get a lot worse. The best time to start doing something about those symptoms is probably when you first went into menopause. That's not always possible. The second best time, though, is now. There are a couple of different ways to approach the symptoms of GSM. One is to use vaginal lubricants and vaginal moisturizers. Those can definitely help. The main problem with those is that while they do take care of the symptoms temporarily, they don't really solve the root problem. The root problem that's causing things like painful intercourse or dyspareunia and all those vaginal and urinary symptoms is the loss of hormones, especially estradiol and other hormones in the genital area. Then there are the really bad symptoms called vaginal prolapse or uterine prolapse. I'd suggest you not look those up on Google. I won't describe them in detail, but it has to do with your female parts basically coming outside of your body. Those are some serious symptoms that vaginal lubricants just aren't going to make any difference with. One of the most effective treatments for the loss of estradiol in the vaginal area is estradiol in what's called vaginal dosage form. There's a product called Imvexxy. It's commercially available and FDA approved. It's a form of estradiol designed to treat GSM and especially the vaginal symptoms of menopause. It's a small vaginal insert about the size of a jelly bean. Along with estradiol, Imvexxy also includes about 17 inactive ingredients, which I've listed here on the side of this slide. I saw a well-known menopause doctor the other day saying that Imvexxy is made with coconut oil, so it doesn't cause any reactions or sensitivities. I'd kind of push back on that a little bit. The inactive ingredients list for Imvexxy does include what's called medium-chain triglycerides, which are made from coconut oil, but that's the 10th ingredient on the 17 in the list. If it is coconut oil, it's not really a major component. One thing you'll notice if you go to Imvexxy's website or see their patient leaflets, they're very heavy on what's called a boxed warning. The package insert has the abbreviation WHI 41 times, and the term Women's Health Initiative shows up 10 times. The FDA wants every woman who takes Imvexxy or any estradiol product to know all about the Women's Health Initiative. Well, the active ingredient in Imvexxy, estradiol, was not used in the Women's Health Initiative, so I'd recommend you take those warnings with a big grain of salt. I've done a few other videos about the WHI and what it says and what it doesn't say. I did some checking about Imvexxy on a few different websites, especially pricing websites. My wife's on an insurance plan that doesn't cover Imvexxy, and that's apparently not an unusual thing. The retail price for Imvexxy is around $260 for 8 inserts. So that lasts you maybe a month. The drug manufacturer offers some sort of coupon to bring that cost down to around $85. I really don't understand the pricing schemes of Big Pharma. It seems very non-transparent to me, in my opinion. If you're interested in getting some relief for dyspareunia, painful sex, and other vaginal menopause symptoms, the first person to check with might be your primary care provider. I've created a simple, downloadable HRT Questions framework to help you ask your doctor about their approach to hormone replacement therapy, or HRT. Visit my website at simplehormones.com/HRT-questions to get a copy of this free resource and start that conversation with your doctor. Your doctor may or may not have heard of Imvexxy, but it's worth asking. If you can't get help from your doctor, I do know a lot of hormone specialists all over the US, Canada, and a few in the UK who might be able to help you. Click the link at the end of this video that says Find a Provider, and I'll see what I can do to refer you to somebody. If you found this video helpful at all, click the like and subscribe buttons. You might also want to ding that little bell to get notified anytime I post a new one. Thanks so much for watching, and I look forward to talking to you again next time.